Well, my presentation is part of a panel on cancer care in time of uncertainty, war, and conflict. And my talk was about cancer care in Syria and Lebanon, the two settings that face sort of protracted long-term crises. Cancer usually is a sort of long-term a disease that needs a sort of a long-term management. And the whole issue of a humanitarian response in time of war, of displacement, of uncertainty is quite a short-term response, so focusing on infectious diseases and basic needs, whereas in cancer we need such a sort of continuity of care. And if there is no plan from the beginning or program to address this long term, so usually the management, the sort of the care for cancer will be shortened, in a way that having like a severe impact on the prognosis of the patient. I would also want to address another point here, which is about the cancer, like many other chronic diseases, is sort of costly health problem, and this issue that need more resources, whereas the humanitarian response in time of conflict or time of crises focus on the issue of that doesn't need a lot of fund, or the fund usually goes to this sort of basic needs. And that's why more money to infectious, family planning, sort of children and maternal health, and less on chronic diseases. And on the top, cancer. So that's so very few patients can get the cancer care, and very rare in numbers that can afford paying from their own. Yeah, there's a sort of dire situation now in Middle East. I'll focus on, countries that face crises: Iraq, Syria, Lebanon. To some extent, countries that receive also refugees, including Jordan. So the whole again issue of cancer care is quite critical because of lack of fund, because lack of enough human resources, including specialized physicians on this, a lack of equipment. Cancer needs like a sort of sophisticated equipment, radiotherapy, a sort of diagnosis with like a sort of advanced technology machines. With this issue of needs, very little is is available to serve those patients. The other issue is there's no enough data to know exactly the situation, which is quite weird, because I think collecting data is not any costly or expensive issue. Collecting data needs sort of policy, willing, political willing, and a sort of experience in doing so. So, but even though there's no cancer registry, there's no data available, and that's why we don't know exactly the size of the problem. We have piece and part from here and there, and we don't know exactly, what could be the main issue to address. So, asking about, what's achieved up till now, main issue is that finally we have programs on NCDs for within the humanitarian response plan, and that could be a first step, hopefully, next time to have programs for cancer in such a sort of response. And second is that we already started that's such a sort of debate about the need to include refugees' health in the national health system, And that could bring, cancer as one of these needs to be responded to. Yeah, I don't want to be very pessimistic. But the future is not very shining. It's still, more protracted crises in the region, and a more drying in fund, more massive movement from physicians, doctors, health workers, nurses, leaving the dire situation, and that will put like a more burden on the health system, and a lot of political tension also. So what can be done is that we need to bring this topic as a sort of a major topic for a discussion, for conversation in the region, and also to integrate, the different population groups in sort of the not just the national system, but also in the regional system.